Welcome back to Connect MKE. Heart disease is the leading cause of death for women in America. 1 in 16 women 20 years of age and older have heart disease. But if you know the risk and when to act, you can live with heart disease. And that is exactly what our next guest is doing now. Shemeka Campbell is here to share her story with the hope of helping others. Shemeka, your challenges with heart disease came early in your life. Can you tell us what happened?
Yes, they came when I was just 24 years old. It was a normal day for me. It was actually my wash day routine. All of a sudden, I felt incredibly fatigued. I was short of breath. My heart was beating rapidly, and I felt like I wanted to faint. The next morning, I actually went to the urgent care, and they sent me directly over to the emergency room because they said my resting heart rate was too high. It was then that I was diagnosed with a condition called supraventricular tachycardia, or SVT for short. I then followed up with a cardiologist and I was diagnosed with a condition called dilated cardiomyopathy, which is a disease of the heart muscle where the heart is weakened.
And had you had any symptoms or anything at all before you had that episode?
Prior to that episode, I had no symptoms that I knew of. However, I was having what I thought was many panic attacks. And I later learned that they were actually short SVT episodes versus the longer 12-hour episode that I had that brought me to the hospital.
Once you were diagnosed, what happened then on your journey to get you to the point where you are now and you're able to live well with heart disease?
After my diagnosis, it was a up and down journey, actually. There were moments where I got better. There were also moments where I had new diagnosis, where my condition had actually worsened. I actually gained a lot of knowledge throughout the journey about heart health and how to maintain it and overall how to live life better.
And as you went through this journey, your doctors really took some significant measures to make sure that your heart is able to stay healthy. Can you tell us a little bit about that? Because you actually have a defibrillator.
I do, yes. As my heart was trending down, my heart was becoming weaker and weaker. My ejection fraction was becoming lower. They introduced the idea of having an implantable cardiac device, or an ICD, what it's called. Initially, I was against it because I didn't want a foreign object in my body. But it wasn't until my sister passed away in 2017, excuse me, at just 31, and she herself passed away from a cardiac issue. It was at that moment that I then decided that I would have the ICD implanted because my heart was on a downward trend at the time. And fast forward to 2021, my heart actually went into ventricular fibrillation. Basically, my heart wasn't beating, there was no blood flowing. And by me having that device, it ultimately shocked my heart back into its correct rhythm, essentially bringing me back to life.
So without having taken that step, you might not be here today to talk to us and to share your story.
That's correct. Without me taking that step, that precautionary measure is what I called it, I may not have been here.
One of the things you talked about your sister, and we're so sorry for your loss of your sister. But one of the things you have talked about is her history. How important is it for women to know family history of heart disease?
It's absolutely important. It's one of the most important things to know your family's health history, just overall. I wasn't privy to a lot of the things on my maternal side's health history because I was raised by my father, but it was after the passing of my sister that I learned that I had an aunt who had a heart disease I had a great aunt who has a pacemaker. I had always known that my maternal grandmother passed away after a heart transplant and her body rejected it. But I was always told that she contracted heart disease from a viral infection. But as I learned more about the history, it clicked for me that this may be genetic and not something that happened by chance.
And it's not always easy to get that information from family members about their heart history.
It's not easy at all sometimes because we are so secretive about what's happening in our families. We don't realize that the little information that we may divulge about our family's health history can save our family member's life. Had I known prior to the age of 24 what my risk was of developing heart disease, I may have made some changes in my younger years.
So you would really encourage people, ask those tough questions, even if you know people may not want to answer them. Ask those questions.
Ask those questions, dig a little deeper, find out what's in your lineage, know what you're at the risk of so that you can modify your lifestyle in some cases to make the change to prevent things such as heart disease or heart attacks or diabetes.
So knowing that family health history is really important, what other advice would you give to women in particular as it comes to talking to your doctor during regular checkups about heart health and the risk you need to understand?
Sure. Other advice that I would give to women, know your numbers, know what your blood pressure should be, know what your cholesterol should be. Also, ask those tough questions. Ask, am I at risk? Develop good relationships with your physicians so that you aren't afraid to ask the necessary questions that's needed. Also, another thing that for myself personally that I used, advocated for myself when I wasn't satisfied with the response that I was getting, I did my research, dug a little deeper. I wasn't afraid to ask those questions. I wasn't afraid to ask my doctors to clarify this diagnosis or what this condition is. It's all about building a good relationship as well with your physicians to understand what your risk may be.
Even though heart disease is the leading cause of death for women in America, we don't always, as women, think that heart disease is what we need to be concerned about. So many more times, women are concerned about breast cancer in particular. How do we, as women, begin to understand the risk that we have from heart disease?
We have to educate ourselves, do the research, know what the number one killer is. Heart disease is a number one killer more than all cancers combined. Just education is important about what our risks are as women in general.
When you take a look at your situation now, and we so appreciate you sharing your story with us, um, you've been able to make those changes. So your health is very good now as you're living with heart disease.
It's stable. My condition is it's stable now. It's not decreasing, but it's slowly increasing. So with making those changes, oh, excuse me, with making those changes to your lifestyle, asking those questions, it allows you to live a fuller life after diagnosis.
Looking back now, what advice would you have given to yourself as a 24-year-old when you had that first cardiac episode?
Hmm. I would tell my 24-year-old self, don't be afraid about what's ahead. This is a new journey for you. Accept your diagnosis, understand your diagnosis, know what your risks are, listen to your body, don't stress, eat, have better eating habits, get more sleep to live a fuller life.
Well, we are thankful for that advice that you are giving us as well. Thank you so much, Shemeka. Continue good health to you. Remember, you can find information on heart disease and heart health at the American Heart Association website, heart.org. Thanks for starting your day with us here on Connect MKE. I'm your host, Denise Calloway. Be well, and we'll see you soon.